Hi, everyone. Welcome to another episode of the Horse Advocate Podcast. This is Doc T. I appreciate you being here. And I have in front of me March 2024 Equine Veterinary Education that just came in the mail. And I opened it up this weekend to see what's going on. And I found a couple of things that were kind of interesting. And I wanted to go over two things. The first was something about kissing spine. Now, a lot of you people have heard about kissing spine, which the name implies that the spinous processes of the vertebrae are coming together and touching and causing lesions. And I've been listening to a lot of people talk about this, and I'm as confused as you guys are. But I'm not confused anymore, because as I've gone through the weeds and tried to figure this thing out, a lot of people are now realizing that the lesions that we're seeing on radiographs are ringers. They are not indicative of what's going on. So let me talk about this one study. And this is just a summary, okay? So this isn't the whole study, but I think the summary is really important. It was done by people in Italy and the United Kingdom, investigating the prevalence and severity of radiographic abnormalities of the intraspinous spaces, the ISSs, the intraspinous spaces, the space in between each spine on the radiograph, in the thoracolumbar vertebrae column of unbroken yearlings, and compared these findings with a group of older trained thoroughbred horses without perceived back pain. So they took a group of horses, they took 47 yearlings, and these 47 yearlings, they did digital radiographic study of the thoracolumbar vertebrae, which means the vertebrae in the back half of the horse, kind of where your saddle ends and the rump begins back there. So they took a look at T7 to L3 and each space, and then they looked at 55 trained horses. So they were 2-year-olds or older, and they were in full training as thoroughbreds. They're all thoroughbreds. And I think it was an equal number of mares and geldings. And they looked at the spacing, and they looked for any abnormalities. And in essence, they said that no differences were found between the groups for number of radiographic abnormalities or scores, because they scored each one on a range. And I thought that was fascinating. So the final paragraph says, this study reported the incidence of DSP, and DSP is a dorsal spinous processes, radiographic abnormalities in thoroughbred horses. So it's just one breed. The absence of differences in occurrence between yearlings and older horses supported a developmental rather than an acquired etiology. So this is really phenomenal. There are more and more people out there saying that spinous, kissing spine isn't really a kissing spine thing. So we now have machines that can blast x-rays through the top, through the back of a horse from one side to the other, and we can see that on our digital x-ray plate. And when I went through vet school, we didn't have machines powerful enough to do this. So this is a new technology, and this is the danger of new technologies. You know, just because we can shoot a rocket to Mars doesn't mean that we should go to Mars. Sorry, Elon. I'm just saying you forgot to ask all the microbiome if they want to go too. But anyway, I digress. So we have a machine that can now radiograph x-rays of the spinous processes, and we're seeing lesions in there. But somebody said, whoa, wait a minute. Are those lesions actually significant? Because there are a lot of horses that they're radiographing and they're seeing these things, but it's not resolving their back issues. And what I found fascinating is in these yearlings that had never had a saddle on them, no one had ever been on their back, they also were having the same lesions found. That tells them that this could be a developmental orthopedic disease. In other words, when the foal starts to grow and they don't grow appropriately, usually because they're overfed, they'll get contracted tendons, epiphysitis, osteochondrosis dissecans, which is a abnormally formed cartilage between joints. And it causes severe lameness in the future and even the demise of the horse by 5 years of age. They're just so crippled, they have to be euthanized. They've seen this in the vertebral facets, which are the two little spots between each vertebrae that help hold and position the vertebrae together in the neck. And when you flex the neck, they actually slip, pinch the spinal cord, and it creates something called wobbler syndrome because it's pinching, compressing the spinal cord. And we've known OCD has affected these vertebrae. And what they're suggesting is OCD is also affecting the development of these spinous processes. Now, keep in mind, this is really important. Nature never makes something it doesn't need. So when you see these huge spines that create the withers of your horse, and those spines go all the way along the back to the very end by the tail of the horse, they are there for a reason. And there are things between those vertebrae, such as ligaments, muscles, and tendons, what I call bone, muscle, tendon units, that creates stability. And the horse has to have a very stable backbone to carry his weight at a rapid speed over uneven terrain, i.e., when you see a horse galloping through the field and up over the mountains and the boulders and the rivers and, you know, everything you've seen in every Western movie you've ever seen of cowboys running, or maybe you're an endurance rider and you know what I'm talking about personally. The point is that backbone has to be solid. And to do that, they have thousands of small, intricate connections that keep that whole backbone together. And what this study is suggesting is if we don't raise these folds correctly, we're going to have a defect already in the top line in these vertebrae. Now, I will continue to say the backbone starts at the head, at the pole, and goes all the way down the neck and all the way down to the tail. And this study is just looking at the last vertebrae of the main part of the body and the beginning of the vertebrae that's going into the rump. And that's just one small section. Why aren't we doing the whole body? Isn't it possible that this idea of kissing spine is basically a bad back that it was built from birth? And remember, and this is just classic knowledge, 60% of the horse's weight is on the front legs. So you have the whole back that's leaning on the front legs, and you have the whole head and neck leaning on the front legs. So the front legs carry, just everyone says, 60% of the horse's weight. So the horse weighs, let's see if I can do math really quickly. 1,000 pounds, it means 600 pounds are on the front legs and 400 pounds are on the rear legs. And on the front legs, 300 pounds on each leg, and on the rear legs, 200 pounds on each leg. Now, that's amazing because the front legs are smaller than the rear legs. The rear legs have more bone, more muscles, because that's used for propulsion, whereas the front legs are just there to prevent the nose from hitting the ground. Think of Tyrannosaurus Rex with his huge hind legs and his little dinky, arms, that old dinosaur with the big teeth and big head and has these dinky arms. Well, the arms of the horse are there to prevent the horse from falling on his nose. But in doing so, there's a lot of weight coming up, and they should be looking for these lesions in the cervical vertebrae or the first part of the thoracic vertebrae, but they're hard to see because to x-ray through the shoulder blade and see them clearly, not so easy. We haven't been able to do that. So what we really need to do is find these horses with sore backs, and if they should die, do a complete postmortem, boil off everything, take a look. Then we have more information. But based on the technology that we've got, they looked at the rear vertebrae of the back, and they said, oh, look, the yearlings that have never been ridden before have lesions that are no different than those that are in training. Now, the downside to this is it's only thoroughbreds. it's only a small number of horses, a total of 102, I think it was, and they're still pretty young. You didn't look at 10, 15, 20-year-olds that have been in training for umpteen years. But I'm going with the assumption that if you take a yearling and then you take a 2 to 3-year-old, that difference in age is still significant because of the amount of training these horses are going through. Granted, the riders they use a postage stamp for a saddle, and the rider stands in the stirrups and puts all their weight on the front limbs when they're galloping. So we can argue that. But the point is, even under training circumstances where the horse is going through a repetitive motion of galloping, the vertebrae are not showing any more excessive wear and tear than what they had as yearlings. So I think that's amazing. And not all of the yearlings had it. I think they said a third of the horses that they look for had these lesions. And that's, to me, that's just significant. I think that's amazing. I don't have much more information on kissing spine, but the question is, if your horse is diagnosed with kissing spine, the question you have to ask them is, so what? I mean, is that where the problem's coming from? Are we dropping a needle in between these spinous processes and putting in some sort of anesthetic or a long-acting steroid that kills the pain down there? Or we're doing mesotherapy? Is that really what we're treating? Or are we treating a bad back due to overweight rider, saddle that doesn't fit? Or, I know it's going to sound like I'm a stuck record, but these horses are 10, 12 years old and they're having these sore backs and spinous processes analyzed and identified as kissing spine, but it could be the muscles of the back are weak because you're not feeding enough protein. Is that a possibility? I think so. Because when I take that book that I read in the past podcast called Horse Diseases of the Horse, the 1916 edition, I couldn't find anything about backs or spinous processes, but even up through the 80s, we're only looking at the hoof as being the primary cause of lameness, followed by a hock and carpus and the pasterns and the flexor tendons. We didn't really look above there. We didn't think that stifles or the back were a problem, but we could argue that we didn't know because we didn't have the technology to look. That's a valid argument. But on the flip side, maybe we didn't have these problems because we were feeding these horses a lot better. And then around late 70s, early 80s, everyone switched over to feeding all these grains with byproducts in them instead of just straight oats or straight corn. And these horses were getting inflammation, and it caused the increased consumption of protein and these small muscles, not just a long, longissimus dorsi, that huge muscle that goes underneath all the spine vertebrae, but the small multifidus muscles that connect each vertebrae together and stabilize them. They may be becoming weak. Now, y'all know as humans that if you want to become strong, one of the biggest things you can do is create core strength. And you can do that by trying to balance on a round object where you're constantly moving, jumping up and down on trampolines, so it's throwing your body off. And so you're building the muscles of the core so they are reacting to the various pressures applied. That's what builds up core strength. Even vibration plates will build up core strength in those muscles on a micro level. That's what's so important. That's why a lot of horses are standing on vibration plates. As they vibrate, that's triggering these muscles to vibrate, and that's actually exercising the muscles. So what I'm guessing, what I'm reading is this whole thing about kissing spine really is not, it's an illusion. It's not a reality. Just because you x-ray it and you see them doesn't mean that that's your problem or that's something that needs to be treated. You have to look further and try to identify, is there another spot anywhere from the pole back to the tail that's creating a problem? And there are good practitioners out there who can help you with that. I know from personal experience, I had lameness in my left forearm, and I was in severe pain for a long time. And finally, a chiropractor came and adjusted a rib that was out of place on my backbone, and my pain in my arm went away. I mean, I wrenched my wrist this past week, and it really hurts to extend it, but it's improved tremendously because I put PEMF on my neck and on my shoulder, and it's helping to decrease the inflammation of the vertebrae as I got jerked by a horse. And now I don't have this pounding, aching pain in my right arm. I should be able to go back to work. So the backbone is very important. All those fibers, those nerves that come out of the backbone and go to all the 4 limbs and to your abdomen are huge. So anyway, so good. I'm done with that. That's kissing spine. And the other thing I want to go to is this suspected idiopathic vestibular syndrome in the horse. This is a case report of 8 horses that were in the United Kingdom. Now, 8 isn't a lot, but that's okay. Vestibular syndrome in horses is basically a head tilt. Not only do you just get a head tilt, and if you're watching me, I've got my head tilted, but you'll get paralysis of one side of the face that will cause the muzzle to be pulled by the side that has tone. So the muzzle goes off to the side. The eyelid droops on that side that doesn't have tone, and the ear flops on that side. So they look, and I've got pictures of this vestibular syndrome, also known as Horner syndrome, in the Horses Advocate website that you can take a look at. And the pupil is kind of dilated as well. If you look at those pictures, you're going to understand what this is. And they decided to take a look at 8 cases. And what was interesting was they tried treatments. They tried prednisolone, which is a steroid, phenylbutazone, which we all know is bute, which is a non-steroidal anti-inflammatory, and physiotherapy, which I'm not too sure exactly what physiotherapy is, but just maybe, stretching or massaging or whatever. And then none for 3 of the 8 horses. And it turns out that none of it was effective. But they said long-term follow-up revealed complete resolution in 4 cases. So 4 out of 8, 50% completely resolved on their own. And I think 5 out of 8 returned to their previous riding and exercise protocol. And I guess a few of them did not respond at all. And that was an interesting article. But as I turned the page, there's a clinical commentary that 2 veterinarians put out from New Bolton Center in Pennsylvania. And it says vestibular disease in horses, recognition, localization, and common causes. And I don't want to get into the weeds on this because most of you will never see a head tilt, but I wanted to refer to you some of the things that could be going on. So I'm going to, they go over anatomy, and they have some really good x-rays and endoscopes. Remember, we didn't have endoscopes back in the 80s. So they have endoscopic exams of the hyoid bones. And they also have not only x-rays of the skull, which are so incredibly good. We had nothing like that back in the 80s. They also have community CT scans, computed tomography, which I think is really shows what's going on, where they can slice through the skull with x-rays and put a picture together. Okay, so common causes of equine vestibular disease and recommended tests. To reach a diagnosis of idiopathic vestibular disease, just maybe I forgot to say what idiopathic is, because that was the title of the first thing, suspected idiopathic vestibular syndrome. Idiopathic means we don't know. It's a fancy term that veterinarians and medical doctors, they shrug their shoulders and say, I don't know, which we didn't think we looked too smart if we did it. So there's a word where they say idiopathic means the same thing. We don't know the cause. Hope you guys laughed at that one. Anyway, all likely alternative differential diagnosis should be investigated and excluded. One of the most common etiologies means the cause of. The etiology of rain is because the clouds were full and they had to let go of the water. I don't know. That's might not be the best thing, but basically that's what etiology means. Vestibular signs, remember, that's just head tilt. And specifically peripheral vestibular disease is temporohyoid osteoarthropathy. And I have a whole section of that called THO in my dentistry course, where we really don't know what THO is, but we find that horses with THO are very difficult to hand float because they just don't like their tongue being messed with, but they don't have a head tilt. So THO doesn't cause head tilting, but with horses with head tilting, you have to invest THO. Again, temporohyoid. That's the naming of a joint between the temporal petrous bone and the hyoid bone. And osteoarthropathy just means basically a disease of the joint. The disease arises due to osseous proliferation at the temporohyoid joint and resultant pathologic fracture of the petrous temple bone, leading to damage of the vestibulocochlear and or facial nerves. Guttural pouch endoscopy and cross-sectional imaging, CT scans, are the most diagnostic useful tools. So I think that's really interesting because I've been wondering what THO is. And I now know that THO and vestibular disease, peripheral, just meaning this head tilt thing, not imbalance, but just a head tilt, could be THO, but nobody knows where it comes from or what causes it. They go on to say for common causes, and this has nothing to do with THO. They say otitis media and interna can lead to vestibular signs. Otitis is inflammation of the part of the hearing mechanism that helps balance the horse. In other words, if this is messed up, you can't walk straight. You'll fall down. The ear, the inner ear, is so critical to your ability to balance yourself that if it becomes inflamed, disease, or whatever, you can't even walk. I'm talking about you, not just your horse. So they're talking about this otitis, which inflammation of can be the result of bacterial, viral, fungal, or even parasitic infections, as well as neoplasia and less common causes. Whoa, that's the whole kitchen sink. They're throwing everything in there. So clinical signs can include head shaking. We've all seen that. Head shaking is a relatively new disease that didn't seem to be around in the early 1980s. And in the 1990s, we started to see more and more of it. And then we get head shaking that's light sensitive or head shaking that's not light sensitive. You put a stocking over their face, over their nose. That helps some. You put green goggles over their eyes. That helps some. So nobody knows what head shaking is. Oral discharge just means something coming out. Oral is spelled A-U-R-A-L, A-U-R-A-L, which means pertaining to the ear, versus oral, O-R-A-L, which means the mouth. Sorry for our English language. I don't understand why I have two words spelled differently that are pronounced the same. But that's just it. We're talking about the ears. Oral discharge, if the horse has accompanying otitis externa and ear droop, in addition to classic uni or bilateral vestibular signs. Okay, so they said oral examination of the ear and endoscopy are challenging in the horse. Yeah, duh. I mean, go ahead and just go stick your finger in the horse's ear. I know a lot of you jumpers put those rubber balls in there to plug their ears, so they think that helps their behavior, and horses are trained to them. But most horses, you get your finger up next to their ear and they're like, I'm out of here. Interestingly, trauma, most often related to collision from a kick, running into a fixed object, or flipping over, can fracture the petrous temple bone, damaging the vestibulocochlear nerve and causing peripheral vestibular syndrome. That makes sense to me. I mean, we don't watch our horses 24/7. And I kind of joked with a lady just today that I could make $1 million if I could create a camera that looks around in 360-degree panoramic view of your horse. So when he's out overnight, you'll be able to see what happened, because we aren't watching our horses 24/7. She says, that sounded like a good idea. And I said, no, it isn't, because you'll be up all night just watching these things, and then you'll never sleep, and then you'll go out and kill somebody. So I don't think it's a really good idea. Just because we couldn't do it doesn't mean we have to do it. But anyway, trauma is really common. Horses slip and fall all the time. They bust a vertebrae. They injure the nuchal bursa, and they can also hit the petrous temple bone. I pray to God it's not because somebody took a baseball bat to them, but that's also a problem. Vestibular disease is a common sequela of basilar skull bone fractures, as occurs when a horse flips over backwards. So if you're flipping your horse over backwards, don't stop doing that. It's just no good. As with THO, remember THO is a temporal hyoid osteoarthropathy, and otitis media interna, traumatic injuries are best evaluated through careful clinical examination and cross-sectional imaging, in other words, CT scans. Now, we here down Wellington have a ton of CT scans. That's no big deal. You just anesthetize your horse and scan their head, and everything's fine. But for all of you who live far away from these central places like veterinary colleges and progressive equine clinics, you don't have the option of having a CT scan. So all you have is a careful examination, and you're looking for any trauma to the head, because if it happens overnight, it wasn't there yesterday and today it's there, it's probably trauma, most likely. But wait, there's more. An important differential diagnosis for central vestibular disease in horses in America, central, not peripheral, is equine protozoal myeloencephalitis, also known as EPM. In the author's practice, EPM is one of the most common causes of vestibular diseases in horses. Despite affecting the brainstem, it can mimic peripheral disease if protozoa localized to the vestibular nuclei unilaterally. So I think it's pretty interesting. So it's still in the brainstem, not out here in the ears, but in the brainstem. But where it localized in the brainstem, it can look like it's coming from one ear. So it's like a magician's trick. And he says the only way, or she says the only way that they can do this is to do a spinal tap. And for EPM, I mean, we all do blood, and the blood comes back with a positive titer. All horses, a lot of horses have an EPM titer. Doesn't mean you have the disease. It means that you've had the disease. But if you do CSF tapping, you draw out the spinal fluid, and you see a rise in that indicator, you know that your horse could be having that disease, and that could be affecting the peripheral or the central vestibular system. And I think that's really important because if you treat for EPM, that peripheral vestibular head tilt, et cetera, should resolve. Other infectious etiologies affecting the brainstem and or the cerebellum, which is part of the brain in the back. Aberrant parasite migration, that's pretty unusual. If your horse has a really good immune system, aberrant meaning a migration of a parasite into a spot where it's not supposed to. In other words, you're driving and you get lost and you're on the wrong road. That could be bad. Or Lyme disease typically cause aberrations in the CSF that would point the examiner away from idiopathic disease. So remember, idiopathic just means we don't know. In the original report, they're saying we really don't know a lot of these things, but if you let it go, half of them should get better. And then the other half of those will get better to a point where you can ride them again. And maybe 1 out of 8 or 2 out of 8 aren't going to do so well. I wish I could give you better news, but if you don't have if it's traumatic, it's going to get better. We can only hope. If it's caused osteoarthropathy of the THO joint, there's surgery for that. And that requires you to find a surgeon who's very good at going in there and cutting out that joint. And apparently there's really no downside to it. Again, nature doesn't put in something that we don't need. but sometimes we can take it out and still live just fine. Ask anybody who's had their tonsils taken out or their appendix taken out. So these horses can do better and will resolve some of their pain. But that's really all I've got. The conclusion is equine vestibular disease is likely to be encountered by the equine general practitioner. Knowledge of the anatomy is important. The report have highlighted an important potential cause of peripheral vestibular disease, namely idiopathic, which means it's a really important cause of the disease. And that important cause is, I don't know. I think that's kind of like veterinary humor, if you will, right there. Diagnosis as such can only be reached after exclusion of all other pertinent possibilities. So in other words, if you do a CT scan and you do a CSF tab, and you do careful examination and you try different modalities of treatment and none of it works, then you're backed into a corner. When you're backed into a corner, you shrug your shoulders and say, it's idiopathic. As they point out, guttural pouch endoscopy and cross-sectional imaging assist in excluding structural abnormalities. Although CSF analysis are not commonly performed in these horses, it should be considered here in America. So there you have it. This podcast, I've gone over 2 diseases, kissing spine and vestibular peripheral disease in horses. And I hope that kind of helps you. I hope I haven't shot over anybody's heads. I hope that kind of helps you understand that we as veterinarians have used tools to advance what we think are diseases, but maybe they aren't. And we're using the same tools to help us get out of that corner of idiopathic and start giving causes to diseases. So technology and medicine can go in 2 different directions. And that's really what I'm trying to say here. So hopefully you're in an area where you can use some of this technology, but if not, keep using your fingers, your eyes, smell, your hearing. They're also important in diagnosing. Always have been, always will be. All right, that's it. Doc T here. Thanks for joining me, and I'll see you next week. Bye.
Hey everyone, Doc T here. Thank you for listening to my content. Would you do me a huge favor? Would you please subscribe, comment, like, thumbs up, and give a star review? However it's presented to you, I want you to do that. There's 2 reasons. The first, of course, is to improve this product. This way I know what you like, what you don't like, what I can improve upon, what topics you want me to cover. But more importantly, it's also going to help others find me. And by doing that, you are now engaged in this mission of helping horses thrive in a human world. By you helping, we can reach others. And that I would be so grateful for. And remember, go to thehorsesadvocate.com for updates on this information. Thehorsesadvocate.com. And again, thank you so much for being here. Doc T out.